Children's Cancer Hospital Egypt 57357 is one of the most stunning examples of what can be achieved when people work together for the common good of their community and world. What started as a dream of a few became the vision of many. Since 1998, the people of Egypt have worked together to build a state-of-the-art children's cancer hospital to achieve the dream of a better tomorrow for our children with cancer. Breaking the frontiers of cure, the Children's Cancer Hospital Egypt 57357 has developed an encompassing mission to cure children with cancer for free, without discrimination to race, creed, or ability to pay, and one that endeavors, with the help of its dedicated, highly trained staff, to establish cost-effective management and treatment systems that are an inspiring model of healthcare delivery and charity. The interior theme, widely utilizing natural light throughout with the selective use of color, makes the hospital a hopeful, secure, and welcoming refuge for the thousands of children who are receiving care there. In compliance with the standards for pediatric oncology care, the patient rooms are single or semi-private to reduce the risk of infection for our immunocompromised patients. The circular bed tower design ensures closer observation of the patient, improving the workflow for the staff, as well as allowing grouping of patients for isolation requirements, specific disease, or age. Patients receive their treatment as in- and outpatients with 187 inpatient beds, as well as a 24-hour day treatment area that treats over 200 children per day. As the busiest department in the hospital, the pharmacy is staffed with experienced, dedicated pharmacists and chemists who prepare over 150,000 medication orders per month, according to current best practice. The principle of pharmaceutical care and clinical pharmacy have been applied in our state-of-the-art department to achieve cost-effective positive outcomes for the patient through patient education, close follow-up, as well as advising the physician and nurses regarding drug incompatibilities, adverse drug reactions, and new drug information. The objective of the radiology nuclear medicine departments is to provide the best quality imaging information that clinicians require to diagnose, treat, and follow up the patient. This busy department is equipped with the most up-to-date versions of CT, MRI, fluoroscopy, ultrasound, bone scan, and the first PET-CT scan and cyclotron in Egypt, and performs over 600 procedures per month. The Ccac Laboratories provide all the necessary services to perform the leading-edge cancer diagnostics, such as cytogenetics, immunophenotyping, flow cytometry, molecular biology, that are an integral part of treatment planning and determining outcomes in a timely, cost-effective, and measurable methodology. The ultra-modern radiation therapy department has 2 linear accelerators, which are of the latest design and can give the most precise measurements with the least amount of side effects for our children requiring radiation therapy. In order to provide more comprehensive care and advanced treatment technologies to reduce the side effects of radiation treatment further, our goal is to purchase a proton therapy unit, a 3rd linear accelerator, and tomotherapy. The departments of laboratory services, diagnostic imaging, and radiation therapy are providing an extra source of income for the hospital by making them available for use by external hospitals and adult patients, and have gained over £20 million per year in revenue. Hospital 57357 nurses play an integral role in the care of our patients, taking a lead on all hospital committees as well as formulating nursing strategies and process. They are a combination of diploma, bachelor's, and master's prepared, and are working in management as nurse specialists in research, IT, quality assurance, infectious diseases, infusion team, and education, as well as the most important role of bedside nursing. The critical care floor consists of a highly sophisticated operating room department, recovery, 26-bed surgical and medical intensive care, and a 9-bed bone marrow transplant unit. These 4 departments are situated together in order to provide our patients the most advanced care they require during the critical phases of their illness, which often may require advanced life support, one-to-one nursing care, and a highly specialized treatment team. The vision of the Ccac Psychosocial Oncology Department is to introduce psychological and social care for the child with cancer and his family through a multidisciplinary team approach, so they will find ways to improve quality of life, manage their fears, and find hope for their future. The department, consisting of psychiatrists, psychologists, and social workers, is the first of its kind in Egypt. With a base of over 2,500 committed volunteers from all walks of life, the CCHE Volunteer Department is involved in many types of hospital activities: play therapy, office support, hospital events, and fundraising. CCHE 57357 is a learning organization whose winning proposition is to put knowledge into action by building its processes on evidence-based practice through continuous improvement in learning, training, and exchanging knowledge with others. CCHE has received training grants from external agencies, recognizing that a well-trained staff of all disciplines and levels will not only provide a high level of care in this complex specialty, but also will result in a satisfied, loyal, and happy staff. Collaborations have begun with prominent international centers such as Dana-Farber Children's Hospital Cancer Center and St. Jude's Children's Cancer Research Hospital. CCHE administration believes that research is its methodology to achieve a world-class hospital and a better future for Egyptian people. By fostering innovation, creation, and teamwork, it is integrating research in all hospital activities. The CCHE Scientific Medical Advisory Committee defined the areas of research, the role of the Central Protocol Research and Review Monitoring Office, and the disease strategy groups. The current focus of research is cancer epidemiology, pharmacology, standards of care, and cancer biology. An internal review board composed of a cross-section of committed individuals reviews, monitors, and approves all studies, believing that our patients should continue with their education during their illness so they may achieve their life goals. CCHE partnered with eminent private school Modern School of Egypt to establish an hospital school for all grades. In September 2012, CCHE signed a formal agreement with Dana-Farber Children's Hospital Cancer Center to begin the first pediatric oncology joint fellowship, which will ultimately include neuro-oncology, neurosurgery, pharmacy, and nursing fellowship programs to increase the number of qualified Egyptian healthcare professionals and to improve the standard of specialized medical and nursing education. The future strategy is to develop a 57357 Health Sciences Training Academy to create a new generation of qualified healthcare professionals. The fundraising strategy that CCHE implemented in 2000 was the first Egypt had ever seen. There were several initiatives used to reach all stratas of society, creating a sense of ownership and excitement of change within all Egyptians. The current fundraising strategy is to ensure sustainability by increasing the endowment fund, selling surplus services to other hospitals, developing an aggressive investment strategy, and recruiting loyal donors nationally and internationally. To broaden our donor base, a group of Egyptian Americans have established a U.S.-registered nonprofit organization in the United States, known as Egypt Cancer Network USA, which is assisting in providing funding for the new expansion, education of CCHE staff, and other special projects. A 350-bed tower, radiology unit, as well as the Health Sciences Academy and Research Institute are in the first phases of the design process with the support of the Egypt Cancer Network USA for the amount of $250,000. A 600-room guest house for children and adult cancer patients from outside Cairo, which will include a light care unit and a 150-bed palliative care unit, are also going into design phase in 2013. Along with the 60-bed expansion in the existing hospital and the 50-bed satellite unit in Tonta, we will have 1,300 beds. The buildings will be built according to the latest standards of green hospital technology, energy self-sufficiency, and at the same time have a family-centered environment. As Margaret Mead said, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. Hospital 57357 is being seen as an icon of change because it has developed a model that all may follow.